Collin Peterson's office. We're glad to be with you and to hear your thoughts and suggestions on healthcare, farm issues, and anything else that Congress will be developing in the months ahead. Let's talk about healthcare first. On the federal level, that's been the hot issue for many months. Collin Peterson, as you're probably aware, voted no on the health care bill as it went through the House of Representatives. It's been one of the hottest issues that we've had for a long time. A lot of strong feelings on both sides of that issue. There are some good things in the bill that Collin supports and readily acknowledges. He totally favors the fact that this health care bill ends the pre-existing condition exclusion of insurance companies, that children are able to be covered under their parents' health care bills until age 26. Health insurance companies can no longer drop you as soon as you get a serious illness. But the fact is that most of the constituents Collin heard from, a lot of farmers, independent business people, people like yourselves who probably pay for your own insurance, have expressed grave concerns for a long time that they can't afford it anymore. Rates keep going up. That was not addressed in this health care bill. Even the strongest supporters of the bill readily acknowledged that to bring other uninsured people under the program, insurance rates will go up beyond the already expected inflation of anywhere from 10 to 13%. And that's fine. We should, that's the American way. I think most people are willing to pay a little bit more to help those less fortunate gain health insurance. But the inflation rates and the uncontrolled expenses, even before that, have not been addressed in that bill. Right now in the 7th district that Collin Peterson represents, about 11% of the people do not have health insurance. Under this new bill, it will cover about a third, about 37% of those that are uninsured. And that's disappointing to Collin. He was hoping that more of the disadvantaged people that he represents would be covered. So that and the fact that the expenses out of consumers' pockets were not addressed led him to vote against it. It was a tough vote for him. He acknowledges that a lot of his supporters were disappointed. He hears you loud and clear, but he would like to remind people that, if you compare legislation to a football game, we're probably at about halftime. The first half was developing a bill. The second half is going to be the implementation of the bill. That's where the Department of Health and Human Services, which is really the lead of many agencies that are going to bring this thing to reality over the next 4 years, 5 years, really where the rubber hits the road and that legislative intent is put into action, where it comes out to us. Collin pledges his full support. It's the law of the land now. He's not going to have anything to do with the political games and rhetoric that we hear about repealing the bill. We're going to make the best of it. He supports, as I said, several provisions of the bill, and he's going to keep working as hard as he can with his colleagues in both parties and in all points of view to address the cost issue for people and to try to make it a workable program. Any questions or thoughts on health care? I'd like to mention just a couple other things Collin's working on.
Has Collin supported the public option part of that somehow got lost in this bill, which would have been a factor in cutting the cost?
Well, he probably would. You know, that was really out of the running so far before it came to a vote, and he was not on the committees that really developed that bill.
Well, last summer
But-
at Farm Fest, he very publicly said that he didn't see anything that had been presented that date about health care that he could support. And damn it, it had been in the mix at that time.